Welcome to UNME Counseling Center. Let us discuss about ADHD, which affects children and adults equally. And today we have Mr. Joshi, who is also a rehabilitation psychologist, who will help us to understand more about this ADHD and in particular adult ADHD. Hello, sir. Please welcome. And our audience is very curious to know about this topic. So could you please help us to know more about this?
Yes. Thank you for giving me a chance to talk for you and me counseling center, and particularly I am also looking forward to talk more about this ADHD. ADHD is a neurodevelopmental disorder, and the full form of ADHD is Attention Deficit Hyperactivity Disorder, which is of two types. One is of inattention and second one is of hyperactivity, which is mostly an impulsive dominance.
Now let us understand how does ADHD typically manifest differently in adults rather than in children.
When compared to children, in adults we find that ADHD has internal restlessness, and people with adults with ADHD especially will have mental fatigue and also struggle with executive function disorders, which will later on have consequences on their financial planning, vocational consistency, and also consistent relationship issues. So when we see in children, this will look like impulsive behaviors or inattention behaviors like fidgety, jumping around, not able to finish their tasks. But in adults, it looks very different.
I think it's a challenge of late diagnosis. And why do so many adults with ADHD go undiagnosed until adulthood?
Well, I would answer this question with an idea about what ADHD actually looks like. It is manifestation of two kinds. One is with inattention type and another one is impulsivity. Most of the time, these two kinds of symptoms are less recognizable when the child is able to mask or compensate with his IQ or intelligence, and most of the time it looks as if he is able to function in a given environment which is much simpler in his childhood. But as the child moves from childhood to his adulthood, the environmental structure is more sophisticated, wherein it looks like he is not able to engage optimally with his earlier symptoms, which was not diagnosed in his early childhood. Secondly, another major problem we see is that most of the time adult ADHD is misdiagnosed as anxiety or major depressive disorder because of the challenges they come on day-to-day basis with their inconsistency in their performance in vocation as well as in social and other relationships.
Thank you for making us understand all the symptoms. Now let us shift the focus to workplace. Could you please let us know that what are some practical and effective accommodations that a person with ADHD could be accommodated with?
Well, as we already know that there are two kinds of difficulties with ADHD. One is inattention and second one is impulsivity. Now, inattention seems to be more kind of a kind of symptom that looks like he is easily distracted. So our focus would be less distractions and externalizing the structure. So it can be divided into 5 areas. One is environment, second one is communication, third one is task management, and fourth one is flexibility, time flexibilities. So first, environment should be less distracted, so we can use noise cancellation devices or a quiet place for him to work. Second one is task management. In task management, we can cut down, do a task analysis, cut down a complex ambiguous task into more micro deliverables so that he will be able to be productive in his workplace. Third thing is communications. Let the person have an opportunity to write down the instructions clearly so that he will not miss out on something that is important. And fifth one is let the employer provide flexible timings rather than traditional 9 to 5 timings.
Thank you for letting us know such a practical and effective techniques for an ADHD. Those suggestions seems to be really helpful, Mr. Joshi. Could you please let us know what are some comprehensive treatment plan look like for an adult with ADHD?
Well, as you know that ADHD in itself is a complex neurodevelopmental disorder. So the treatment plans is pharmacotherapy as well as psychotherapy. If they go parallelly, it is very, very beneficial and helpful. In pharmacotherapy, we have stimulants and non-stimulant drugs which are generally prescribed by a psychiatrist. Most of the stimulant drugs that are being prescribed for ADHD are what we call as amphetamines and methylphenidate. And non-stimulant drugs seems to be more like atomoxetine and selective non-adrenaline inhibitor, reuptake inhibitors. So when we understand ADHD comprehensively, we would know that only pharmacotherapy might not suffice. Henceforth, parallelly, a psychotherapy like CBT, that is cognitive behavioral therapy, or psychoeducation, wherein it helps the adult with ADHD to understand his condition and work through the problems and systematically have a behavioral plan, might be a comprehensive treatment plan for adults with ADHD.
Thank you for such an insightful discussion, Mr. Joshi. For any further such clarifications and consultations, please visit UNME Counseling Center. We are located at Bhagningapalli and also at Madhapur locations. Thank you.